National Institute for Communicable Diseases. Thank you very much for being with us, and maybe you can help us with something that was clarified but still leaving a few questions unanswered about the 2 deaths, and now the presidency saying in fact it's 1 death and 1 confirmed suspected case rather of COVID-19. Can you clarify?
I'm not in a position to clarify at this particular time. I'm sure that the Department of Health will certainly respond to what has happened. I think they said that 1 death, as you said, was linked to coronavirus infection, and the other is still to be investigated further. And I think this gives us pause for thought when you look at what has been happening in other countries and the deaths that have occurred in those countries. You've seen the explosive deaths in China, Italy, Spain, and now the United Kingdom, the United States, and so forth. So this gives us pause for thought as to who are those at high risk in terms of this current infection and the current pandemic.
And what are we doing about it? So your reaction then to how you feel South Africa has done on the first day of the lockdown?
Well, my sense is that this is an important step for South Africa in terms of managing the outbreak. One can see that countries have been grappling with how to approach the control of the epidemic as we currently see it. And South Africa has taken the step that I think various countries have approached, including China, Singapore, Hong Kong, and that is really to say that if we left matters as is, what are the numbers of individuals that we're going to see infected in a particular time period? And what can we do to prevent that number from occurring? And the lockdown is part of that particular process to limit the spread of this epidemic. If you can think of a link or chain of events, so this is the branch, if you like, and these are all the individuals in that particular branch. And if we can just break those branches or those links, we will be able to slowly and surely try and control the spread or the transmission of this particular virus. So you can see the rapid growth from the 1st of March up till now. You've seen that exponential growth of the number of cases, and we're all the epidemiologists now as to how to flatten that curve. So we've seen this very steep rise in cases, but how can we flatten it? And this lockdown is in part and to try and address that by social distancing, for example, to break those particular links and transmission.
Yeah.
But it's not the only part. Because, as you know, we've got those initial infections. We've got about 1,000 odd infections currently. So how do we try and control that, the further transmission in those particular clusters or those areas? And so tracking and tracing them as part of this lockdown is really a critical response as well.
Yeah. So you're saying how important it is to flatten the curve. We know that prevents health facilities from being overwhelmed and people maybe dying or not get the help they could because of that situation. Were you watching in dismay, therefore, the shops, queues outside, people standing very close together, no social distancing in some parts of South Africa today?
Yeah, it's a very, I think from a psychological point of view, an epidemiological point of view, and a sociological point of view, this is very difficult. I think people trying to grapple with what is this epidemic about and trying to get the messages across is really key in how we do it so that we don't have the resistance and the obverse of what we're trying to see, and that is to control that. And under certain circumstances, it's going to really be very difficult. I know I've just touched my glasses, for example. So how do we, encourage people to wash their hands, to use sanitizer, to do that spatial or physical distancing? I think it's going to be really hard, but I think we've got to try and encourage and get those messages out as easily and as simply as we can by really trying to illustrate is that if we can break those links, we can overcome those particular problems. And as you know, South Africa has the highest rates of HIV and TB. And again, it's really critical that we ensure that people know their status beyond the antiretroviral drugs, because again, we're not really clear as to what effect this virus will have with regard to those particular individuals. We know from flu that even if you're on treatment as an HIV patient, you can still have a poorer outcome.
You're so right. This is about making an invisible threat real and looking at our set of circumstances as well. Looking at other countries, looking at the trajectory that we were on. Can you make this real for South Africans? Do we know how many potential lives could be saved if this lockdown is done properly?
I don't have all the figures. I know that there was talk about, let's say, 600,000 individuals by the 16th of April, if we just left matters as is. So can we try and change that to a lower figure, let's say 100,000, 70,000, for example? Those are the particular models which are complicated and takes into account various parameters. So I think the idea is to see, well, how, as I said, coming back to the idea of how can we flatten that particular curve. And I think that's what we will be looking at the end of this particular lockdown. But even though that lockdown may end, all those other things that I've mentioned, for example, the social distancing, the washing of hands, the use of gel sanitizer, all of those aspects still have to remain in place.
Sure. And even if we flatten the curve and you put out a number there, 100,000 maybe infected, does South Africa stand ready? Do our health facilities stand ready to deal with even that number if that's on the low end?
Well, I think what I need to say quite clear, and I haven't been clear on this, is that, again, the majority of people who are infected with this particular virus will have a very mild disease. I think our biggest concern are those individuals who have, for example, an initial comorbidity, if you like, if they have heart disease, cancer, for example, respiratory diseases. These are the individuals who currently, and older individuals, who will have a more severe disease and a poorer outcome. So again, if you can imagine the growing number within that proportion, or let's say 10% who have these comorbidities, are going to overwhelm our system. I think we have about just under 7,000 ICU beds, for example, in combination with public and private. So how do we address that? How do we gain greater access to more beds, for example, and manage that? And so part of not reaching that particular point and the deaths that we're seeing is really trying to manage the epidemic at this particular point as best that we can.
Yeah.
And as rigorously as we can.
Well, is that being done? So government earlier spoke about imports being fast-tracked, exports being stopped of anything that's needed in South Africa, a prototype for a ventilator. Are we doing the right things and are we doing it quickly enough?
I think as best we can. As you can imagine, because this is a pandemic, there's going to be lots of competition for resources, for example, in different countries. So, for example, South Africa would like to really scale up testing, for example, because they see that as a very important part of control of the epidemic. So again, but gaining access to reagents, machinery, equipment, and so forth does present its particular challenges, not of our own making, but because of the nature of the pandemic at this time.
All right, thank you very much, Professor Adrian Puren from the National Institute for Communicable Diseases.